Good day, everyone. My name is Jan Alan Ambistao from BSN 1C Group 2, and today I'm going to perform a return demonstration of the assessment of skin, hair, head, and eyes. So, this assessment is very essential in order to because it helps check the status of the health condition and the condition of the skin, hair, and eyes of the patient. Moreover, it also helps the patient to gain information about defects of each parts of the head. So moving on to the preparatory phase, first is you're going to reassess the medical records of the patient if available. Then you're going to determine the scope of the assessment and prepare the necessary equipment. So here are my equipments. I had prepared a pen light, a tuning fork, a pencil, and gloves if the patient has any skin lesions such as drainage, and the what do you call this, the Snellen chart, and the alcohol-based hand rub for hand hygiene. So next is you're going to perform hand washing and don gloves if necessary. So here I have a alcohol-based hand rub. Next is you're going to introduce self and verify the client's identity. So, good day, sir. I'm your nurse for today. My name is Jan Alan M. Distajo, and today we're going to assess your skin, head, and ears and eyes. So, may I ask, sir, if may I ask your name
Alimar Unahan,
and when is your birthday?
November 9,
How old are you?
18,
And your religion?
Roman Catholic.
Okay. So the rationale on this is when you introduce yourself to the client, the goal is to establish a trusting and supportive relationship between the two of you. So I'm just going to get my pen. So again, in introducing self and verifying the client, the goal is to establish a trusting and supportive relationship in order to gain information and to offer information. So next is you're going to explain the procedure to the client. So today, sir, we are going to look into your skin, head, eyes, and ears for us to see the conditions of each. So then after our procedure, we'll be looking at the findings that we will gather after the procedure. So is it okay for you, sir?
Okay, nurse.
So next is you're going to position the patient and provide privacy. So the rationale in this is that providing the patient with privacy and comfortability is a crucial or a vital state so that the patient will be comfortable and will be at ease. So are you okay or are you comfortable with your position, sir?
Yes, nurse.
So do you have any concerns?
No, nurse.
Shall I proceed?
Yes.
Okay, so moving on to the assessment phase for the skin. First is you're going to inspect the color of the skin. So karon sir atong i-inspect ang skin color nimo, sir. So is it okay for you if I touch your skin, sir?
Yes.
Okay, sige. Wait lang, sir, ha? Sige, sir. Are you experiencing any current skin problems such as rashes,
No.
lesions,
No.
dryness,
No.
oiliness,
No.
drainage,
No.
any bruising,
No.
swelling,
No.
or changes in skin color?
No, nurse.
So, any of these symptoms may relate to a pathologic skin condition. So, the nurse should find if there are any kinds of these symptoms or common concerns. So ato lang inspect ang imong skin, sir, ha? Tigas. The next is inspect for uniformity of the skin. So, do you have any birthmarks or moles, sir?
No.
So, if so, please describe so you don't have any. So, next is you're going to assess for edema if present. So ato lang i-check, sir, if you have any edema. So, I'm going to press your feet, sir. Okay lang ba mo, sir? Next is you're going to inspect and palpate and describe skin lesions. So are you experiencing any pain, itching, tingling, or numbness, sir?
No.
Like recently to your skin, wala kay ka ng murag katul or binhod, wala. So the next is you're going to observe and palpate the skin surface. So ako lang i-kuan, sir, ha, atong imong skin, sir, ha. Okay. Okay. Then note for skin triggers. So, okay, sir, I'm going to check for skin triggers. So, is it okay for me to pinch your hand, sir? Sige, sir, ha? I-pinch lang na ako imong hands. Sabi ka, sir. Okay. Then moving on to the head and face. So first is you're going to inspect the head for size, shape, symmetry, and contour. So, karon, sir, ako lang i-inspect ang imong head. So, pwede na ako gunitan ang imong head, sir. Yeah. Okay. Next is you're going to inspect the face for symmetry, features, movement, expression, and skin condition. Sige, sir. I-kaan lang nato, sir. Pagliyok-liyok lang sa iya lang pagliyok, sir, ha. Then inspect the hair for its distribution, quantity, and color. So, sir, ato lang i-check or inspect ang imong skin, imong hair. So, ato lang, pwede na ako ganitan, sir, imong ulo, sir.
Okay, nurse.
Yeah. Okay. Next is palpate the scalp. So, I'm going to palpate your scalp, sir, ha? Okay. Next is I'm going to palpate the temporal arteries using the tip of my index finger, middle fingers, and middle fingers and feel the pulsation. So karon sir, ako i-palpate ang imong TMG diri nga part sir. So I want you to sir, sige sir, I want you to open your mouth. Close. Open again sir. Close. Okay, very good. Then moving on to for the facial muscles. So we're going to test your facial muscles, sir, ha? So I want you to raise your eyebrows. Sige sir, i-raise na to atong eyebrows. Iubos. Itaas otro. Iubos. Then, I want you to bare your teeth, sir. Yan na, sir, ngisi. Okay. Then, i-close. Then, next, I'm going to pop your cheek. Sige, sir, ha? So, next, sir, atong i-close lang nato gid atong mouth, ha, while I try to open it, sir, ha, to see if the muscles of your mouth, sir, has no defect. Sige, sir, ha? Very good. Then moving on to the eyes. So for assessing the visual acuity, check for use of any visual aids prior to starting the test. So I'm going to next sir, we're gonna use the Snellen chart. So for this procedure, have the patient stand for 20 feet or 6 meters from the Snellen's chart or E-chart. Cover the eye by being tested and ask him or her to read each line until he or she cannot decipher the letters or their direction. So karon sir, mag-try na ta aning Snellen chart. So I want you to cover your eyes, sir. Cover your eyes kanang imo sang isa ka eye. Then imo ni siya i-try og basa, sir, ha. Sige sir, we try to read, ha. Ato lang ni basahon, sir, ha. Sige.
E F P T O Z L P E D P E C F D E D F O Z P.
Mabasa pa, sir?
Dili na.
Okay, next. Next, sir, your right eye. So i-cover na po nato ang imong right eye. So ang left eye na po dahil magamit, sir, ha. Sige sir, try to read.
E F P T O Z L P E D P E C F D E D F C Z P.
Tapos sir, mabasa pa, sir?
Dili na.
Sige sir, both your eyes.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D.
Mabasa na, sir?
Dili na.
Dili na mabasa?
Dili.
Okay, very good. So moving on. Next is you're going to note the findings based on the Snellen chart. So you're very good sa 20/20 kataman, sir. Then moving on, you're going to perform selected vision tests such as light perception, hand movements, then counting fingers if necessary. So if the patient is unable to read or to see even the top line 20/200 of the Snellen chart. So mag-try ta, sir, ha, kanisa kamot, sir, ha. If pila ba ni? Okay ni. Pila ni, sir?
2 3 4 5.
Okay. Then Moving on to the test for visual aids, face the patient directly at a distance of 60 to 90 centimeters. So, instruct the patient to look directly into the examiner's eyes with both eyes. So sir, I want you to look into my eyes and dili lagi ka mag-focus ako eyes, sir, ha? Then, place hands about 2 feet apart lateral to the patient's ears. So, karon sir, I want you to tell me if you see my hands wiggle, sir. So, ako siya i-ana and you're gonna say yes if or now if makita na nimo kung kamot, sir, ha? Sige. Mag-una ta sa diri nga part, sir, ha? Okay, very good. Sa next na po, sir, sa left. Sa right nimo.
Kita na. Kita na. Kita na.
Okay, very good. Then, repeat the test with the other eye. So, I already repeat the test. Then, moving on to the visual inspection of the eyes and the test for oculomotor nerve. So, inspect the eyes for alignment and symmetry. And inspect the eyebrows for hair distribution and alignment and skin quality and movement. So, karon sir, mag-check na ta sa imong eyes. So, I want you to hold lang, sir, ha. Open lang natin itong eyes, sir, while I check your eyes, sir, ha. Okay. Then inspect the eyebrows for hair distribution and alignment and skin quality and movement. So ato lang i-check ang imong eyebrows, sir, ha. Pwede lang nako siya i-touch, sir.
Yes, nurse.
Next is I'm going to inspect the eyelashes for evenness of distribution and direction of curl. So sa imo na pod eyelash, sir, ha. Yes, sir. Then inspect the eyelids for surface characteristics such as skin quality, and texture. So position in relation to the cornea, ability to blink, and frequency of blinking. So atong inspect imong eyelids, sir, ha. Sige, try og pilok, sir. Hinay lang nga pilok. Sige, sir, try og pilok, sir. I-open, close. Close, sir. Hold lang close, ha. Okay, very good. Open na, sir. Then inspect the lower eyelids while the client's eyes are closed. Then inspect the area over the lacrimal gland and lacrimal sac for swelling. So, sir, ako lang i-check diri nga part, sir. Then, I'm going to ask you, sir, to look up so that we can assess the sclera and bulbar conjunctivae. So, sige, sir, ha. Try to look up, sir. Okay. Then, invert the eyelid to assist the palpebral conjunctiva and oculomotor nerve. So, karon, sir, akong i-try og kuan sir, i-check ang imong i-close lang imong mata sir. Sir ha. Sir, hold lang sir. Then inspect each cornea and lens for opacities, clarity, and texture. So, karon sir, I'm going to shine a pen light para ma-inspect na to ang imong cornea, sir, ha? So, assuming that this is a pen light, so shine a pen light from the side toward the eye, or shown a pen light at an oblique angle to the eye, and move the light slowly across the corneal surface. So, karon sir, I want you to look straight ahead while I'm going to do this. So, sige sir, tanaw lang ka, diri sir ha, diri sir. Then moving on to assessing pupillary reaction to light. Darken the room partially and ask the client to look into the distance. So karon sir, I want you to look straight lang sir, gyapon sir. Yes sir. Pikas. Okay, very good. So next is assessing the accommodation. So hold an object about 10 centimeters from the nose, from the bridge of the nose of the patient. For example, I'm going to use a pencil. So karon sir, I want you to look at this first object, at the top of this object. The next, you're going to look this other object, okay? Sige sir, try na to sir, sige. Tapos din na po sa pikas. Okay, balik na rin. Din na po sa pikas. Okay, very good. So, kanina po sir, i-try na ako sir ha. Tanawin yung object lang sir ha. Sige sir. Okay, very good. Moving on, we're going to assess the extra ocular movements and testing of the oculomotor, trochlear, and abducen nerves. First is I'm going to stand 2 to 3 feet in front of the patient, and then ask the patient to follow the finger, or as it moves to the upper right, lower right, upper left, lower left, lower right, lower left, far left, and upper left. So karon sir, imo tan-aw ni ako kamot sir ha. Imo lang sundon sir ha, okay? Okay. Okay, very good. Then you're going to look for jerky movements of nystagmus on lateral gaze and on upward gaze. So next is watch for a rim of sclera between the upper lid and iris as the eyes goes up and down. So, sige sir ha, itry lang natin ito sir. Okay, very good. So next is to test for convergence. You're going to ask the patient to look at you and look at your finger as you move it towards the bridge of the nose. Check any for convergence. So, karon sir, I want you to look at my finger, sir, ha? Karon sir. Yes, sir. Okay, very good. Then moving on to the ears. So visual inspection of the ears. So for the ears, inspect the ears for alignment and symmetry. Note for color, size, and shape or drainage. So karon sir, pwede ba nako i-touch ang imong ear sir para ato lang i-inspect?
Yes, nurse.
Sige ha. Pika, pwede sa pika sir. Okay, very good. Then, assess for consistency and tenderness. So, palpate tragus and helix for tenderness, and palpate mastoid process behind the ear for nodules and swelling. So, karon sir, akong ipalpate ang imong tragus, sir, diri nga part, sir. Okay lang ba sa imo, sir?
Yes.
Okay, sa pikas. Okay. Then for the test for hearing, in whisper test, have the patient cover opposite ear being tested, and the examiner should stand away from behind from the patient, 1 to 2 feet behind, and note patient's ability to hear sound. So karon sir, ato lang ni forward ang atong chair sir, atong karon sir kay para mag-stand ko behind nimo sir. Okay lang ba sa imo sir? Sige, sa sir ha. Sir. Hindi ka lapit sir. Yes, good sir. Sige, I want you to tell me if i-cover sa nato dre sa imo left ear sir. Ato lang i-cover sir. Tapos mingon ka kung madungog lang ba nimo. Akong i-whisper ha.
Dungog.
Okay, next is next na po sir sa pikas nga ear. Yes sir.
Dungog.
Okay, very good. So, ibalik na ito, sir. Yeah. So, next is the Weber's test. So, hold tuning fork by the stem and tap tuning fork prongs on the palm of your hand. So, in the Weber's test, so let's just assume that this is a tuning fork since I don't have any tuning fork available, and we don't have any cartoons as well to print. So let's just assume sir that this is the tuning fork. So karon sir atong i-kuan ang tuning fork, ako siyang gamiton para ma-determine kung asa tama ng imong pangdungog sir. So mag-ingon lang ka kung asa mas kusog ang madunggan nimo, sa imo bang left, sa imo bang right, sa imo bang left, or asa ang tuning fork sir ha, sa tunga ba? Okay. Tunga. Okay, very good. Then moving on to the Rhines test, place vibrating tuning fork on the mastoid process and count the time until patient can no longer hear tuning fork. So karon sir, ato i-try ang Raynaud's test. So ato nang idikit ning tuning fork sir. Pag ingon lang sir ha kung madunggan pa ba nimo. Sige sir, ako nang patinggon sir ha. Madunggan pa?
Di na.
Okay. Again sir ha. Madunggan pa?
Di na.
Okay. So, continue to note the length of time until the patient no longer hears sound. So again sir, mag-ingon lang gid ka sir kung di na madunggan na. Okay, again.
Di na.
Okay. Then moving on to the Romberg's test. So karon sir, mag-stand lang ka sir ha. Mag-stand na ta karon sir kay i-try na to ang Romberg's test. So I want you to close your arms from each other, so like that. And you're going to keep your feet together. Sige sir, dikit siya sir. Dikit siya. Tapos close your eyes. Yeah, you close your eyes sir. Okay, very good. Okay. Ba't na yung sir? So, that was it. So, moving on to the termination phase. Review the information obtained during the assessment phase and discuss findings to the patient and present to the client the gathered information after the assessment. So far sir, for our assessment, everything is normal sir, especially from your starting from your scalp, your hair, your eyebrows, your ears, and your face. Your skin is normal. You don't have any lesions, right? You don't have we didn't find any bruising, swelling to your ears, the nodules, and to your eyes. We didn't saw anything like any defects. So everything is normal, sir. I want you to keep that up. So that's a very good sign of keeping yourself very healthy. Then next, you're going to measure client's understanding of the plan and need for further teaching. So provide the client the opportunity to clarify or raise any concerns or any questions. So, naba kay questions, sir, or naba kay any anong concern about your health, or basi na kay na feel ngalain lang, wala lang nato na notice? Naba sir, wala.
Wala, nurse.
So, okay lang ka sir.
Okay.
So, you don't have any sign of any concern.
Yes.
Okay, so I want you to keep your practice, your health practice as well as your lifestyle, sir, since normal naman gid ang imong ang atong findings. Then thank you for your time, sir. I am glad that you cooperated very well, and thank you for your coordination or cooperation. So dito lang taman sir ang atong assessment. I hope that you will keep your health, and I hope that you will always be healthy and keep your lifestyle and health practice, okay? So moving on, you're going to end the interview politely and then perform hand washing or hand hygiene. So here I have a alcohol-based hand rub. Then you're going to document the findings. This will serve as a baseline for comprehensive nursing care plan of care. So, I'm going to note the findings. So that's it for the assessment of skin, hair, eyes, and ears. And I hope you learned something. Thank you and God bless.